Hello, listener, and welcome to the Southern 7 podcast. I'm Shawnna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy. And it's recorded at our main offices in Ullen, Illinois. Southern 7 Health Department and Head Start serves the lower 7 counties of Illinois with public health clinic offices and Head Start centers in each of the counties we serve. If you like today's episode, please tell a friend and make sure to check out our other podcasts at southern7.org or by downloading the Southern 7 app. Well, I'm really excited about today's podcast because we are going to talk about a special cancer event that we, and I mean healthcare providers that serve the lower 7 counties in Illinois, have been talking about and planning for some time. In today's episode, I'll be chatting with Harry Brokus from Union County Hospital about the upcoming and first ever for our region, Cancer Warriors Walk for Hope. We're going to dive into why this free, fun family event is so needed in our region and ways cancer prevention and treatment is changing lives right here at home. So stick around. We'll be back with today's episode right after this.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Over the last few years, cancer prevention has progressed by leaps and bounds, and one way is through genetic cancer testing, which is simply the process of looking for genetic mutations in your DNA to determine your risk for developing certain cancers. To find out if you qualify for genetic cancer testing through Southern 7 Health Department, visit southern7.org or call
634-2297.
Welcome back to the Southern 7 podcast. I'm Shawnna Ryan. Joining me today is Harry Brokus. He is the Chief Administrative Officer for Union County Hospital. Hello, Harry. Thank you for being with me today.
Hi, Shawnna, and hello to Union County, the whole Southern 7 Health Department area.
Oh, definitely. Union County is one of the counties that Union County serves, so I'm so happy to have you with me today. We're going to talk a little bit about Union County Hospital, but first, we're going to tell why we are chatting. And it's something that I know that our team has been working on for a while, and we've tried to get this together for a number of years, and for this reason and that reason, COVID, it just doesn't happen, so we're excited. But we are going to be having our first cancer walk. It's actually called the Cancer Warriors Walk for Hope. It's going to be on September 23rd from 10 to 1 at the Dorothy Miller Park in Metropolis. And Union County Hospital is one of our partners in this effort. We're also partnering with Massac Memorial Hospital, Rural Health, which is just right across the road from you guys. We've also got Chessie, which is Community Health and Emergency Services, the Hope Light Foundation, Banterra Bank, and many others. So we appreciate everybody's support and the opportunity to be able to share this with you. So as you're listening to this podcast, please make sure that you're sharing it with others so we can get the word out about this event. So we're going to put the event on the back burner for just a minute, Harry, and talk about Union County Hospital and your support in this effort. Why would Union County want to be a part of this? I mean, tell us a little bit about how you support cancer families in your region.
Yeah, well, I think it's important to understand that cancer touches everybody's life, right? And on a personal note, I know that Southern 7 Health Department is big in ovarian cancer as well, and my sister died of that when she was 35 years old. And I think back to that time and what it did to my family and what resources we needed. And that's why, it's great to be part of a hospital that can provide that kind of support within a community. The important thing about Union County Hospital is you can come here and get these supportive services without having to travel, right? So a lot of people go to St. Louis for cancer care. People go to Mayo for cancer care, but you can't go there every day when you need a Neulasta shot or you need a special IV just because you're getting a little dehydrated, or you need to go to the emergency room because maybe you're just not feeling well. So that's how we can support cancer care right here close to home for our patients in Union County and throughout the region. And that's why it's important to us. These people are our family. They're in our family and they have cancer and they deserve care. And that's what we want to be able to provide for them.
So it keeps them from having to travel those long distances just to be right there at home, because the hospitals or the physicians, the nurses at Union County Hospital work closely with their doctors, correct?
Absolutely. And I don't think people understand that. When you come in here, we'll actually call over to wherever hospital you're currently at, whether it's in St. Louis or Mayo or over in Evansville or Indianapolis, and we talk to your doctor. We make those phone calls on a regular basis, tell them what's going on, give them the information that we have in the medical record. Then we work with them to come up with a solution. Sometimes that solution can be handled locally. Sometimes we have to transfer them. But yeah, that communication is clear and consistent, and it's another way that we can help care for people locally.
Very good. Well, that's so important because we do live in a region where we have to travel sometimes 50 to 100 miles for cancer care. But you also do screenings, some screenings there at the hospital, correct?
Very important, right? And we are blessed that several years ago now, we got a 3D mammography unit that was donated to the hospital through our district. And, we do over 1,200 mammograms a year. And we have a radiologist here on site that helps with our diagnostic mammogram so that we can make sure that the information gets back to our patients in a timely manner. So we're excited about being able to offer that technology here in a small community. And it's important, right? Because early detection, whether it's breast cancer or any other cancer, early detection is the key to success and survival. And so we believe that that's very positive. And on the other side as well, we also offer colonoscopies. If you're over the age of 50, you need to be having a colonoscopy done. If you're high risk, you need to have them done more frequently. But we have Dr. Johnson here now. He's been here for 1 year as of this month. We're excited that he's here. He's our general surgeon. He also does the colonoscopies. And what's great about Dr. Johnson is if he finds something wrong during the colonoscopy, he's a general surgeon. He doesn't have to refer you anywhere else. So he actually goes ahead and help do the surgery himself and cut out the cancer and make sure you are well on your way to being healed. So it's great to have those kinds of services in a small community like ours. I know the population is really supportive of him and what we're trying to do here.
Well, and Union County is the only hospital in our region that Southern 7 partners on through our colon cancer screening program. We have a program here called FIT, which stands for Fecal Immunochemical Test. And we partner with you all to where if somebody can't afford a colonoscopy, then they can get a colonoscopy through you all. Now, we are limited on the number of those that we can do, but it is a service that we can provide to folks. And the health department and the program that we work with actually helps to cover the overnight stay for you and some other expenses. So we appreciate that partnership with the hospital as well.
Yeah, I'm glad you mentioned that because I don't want people that live, 30 or 40 miles from a hospital and they say, well, I can't even get there for my colonoscopy area. Well, we will figure that out for you.
Right.
If you need a colonoscopy, get it scheduled. Our case management team will work with you to find transportation services to get you here. Sometimes you may say, well, I got to do all that prep and I don't want to do that at home. That's why we offer you the overnight stay. You're welcome to come in. It's just like a hotel. Our nurses will care for you overnight. They'll give you the prep. They'll be there with you as you go through the process. And the next morning, you'll be ready for your colonoscopy. And that way, we make sure that everybody has the ability to get a colonoscopy and determine whether they need further care. That's a big part of the process. Cologuard's another thing. A lot of people are using Cologuard now, and that's good for if you're not a high-risk patient for GI cancers. So that's another option that we can offer here through the hospital. So we want people to get those screenings done. We don't want you to find out later on down the line that it's too late.
Right. And colonoscopies, mammograms, those types of screenings, you and I know if you get those done early, it prevents a lot of problems down the road. So I know they're not fun. I've had them. And I know they're not fun, but the trick to a colonoscopy, though, is if you don't eat that last day before you have the day where you're not supposed to eat a lot, if you don't treat that day like it's your last meal day, the process is a whole lot easier. Eat small a few days before. Don't just cram it all in because it's got to come out. I know that's fun.
No binge eating.
That's right. No binge eating that last day. Exactly. Now, also too, when we think about cancer in our region and how important it is to get those earlier screenings, one of the things that we've been talking about with Union County Hospital is our genetic cancer testing program. And I know that is something we just started here this summer. Is that something that you all are offering at the hospital?
Not currently today. We don't employ a geneticist and we haven't contracted that out, but I think that's something that as we move forward as a region in the future, now being a part of Deaconess Health System, I think is going to bring those types of services available to our region. So we're excited about what the future holds in that.
Very good. Are you seeing more doctors at the hospital talking to their patients about genetic testing, or again, is it still something that's kind of new?
We're seeing more online. We're seeing more patients coming to us and talking to us about it because they read about it online, right? So
Right.
our doctors are there and willing to talk about it with them, but it's still fairly new to everybody. But you can tell the folks that are online and really reading about it and are getting serious about it. And I've met women in my life who have gone and had breast removed based upon genetic testing that were not even positive for breast cancer at the time, but didn't want to take the chance.
Right.
And so those kinds of technologies and advancement in medicine are really going to change the way we look at cancer in the future.
Very much so. And, like I say, we started doing genetic cancer testing through a company called Invitae. We started that this summer. And for those of you that are planning to come to the Cancer Warriors Walk for Hope later this month, we are going to be having that testing there as well. So it's good to see that, this is something that as public health, we jump on. And I know you jump on as well. And it just takes time to get these things into place. So it's exciting to know that you guys are looking into that and getting that going.
Well, we have to keep up with the technology and the times. And so it's an important part of being here for our community. So.
Exactly. Well, we kind of feel like we're behind down here in this part of the state, but hey, we're getting there. It takes quite a bit. So it's exciting. Is there anything else that you want families to know, or patients to know about Union County Hospital, maybe some of the other services that you provide?
Yeah, and it directly relates to cancer care as well. Lots of you folks that have cancer have to have regular blood testing, and I want them to know that any type of blood testing can be done here at our hospital. For things that we don't do internally, we can send them over to Deaconess in Evansville. But if you've got tests that are being ordered from your doctor in other parts, other areas of the country or other states, you can still come here and get that laboratory testing done, and we're happy to take care of you. And I think the one thing people don't know about our hospital is we have a very robust imaging center. We actually have all the imaging modalities available to us here. So not just general x-ray, but we do ultrasound, we do echocardiography, and we have our own MRI. It's not a truck that pulls in, it's built in, it's right here in the building. Yeah. And so when you have those kinds of exams that need to be done, give a shout out to Union County Hospital. We'll be happy to take care of you. We know it's a part of your care and getting routine follow-ups for your doctors. And again, you don't want to have to travel 100 miles to get a CT because you're going to the doctor next week. You can get that CT done right here today. We have the ability to send it to your doctor digitally, and they can review it from there. So those are the kinds of things that people don't think about that we want them to become more aware of about Union County Hospital.
Oh, that's exciting. That really is. And like I say, from a public health standpoint, we can only do so much. And so it's good that we can tell our patients, you can go to Union County Hospital for these additional services. That's exciting. And I live in Union County and have used Union County Hospital on numerous times, have doctors there. And it's exciting to see how things are, I don't want to say improving because that's not it, but just how things are just growing in terms of services that you provide.
Things are growing and they are improving. And, right now we're also working on a 5-year strategic plan that's going to include new buildings, complete restructure of the hospital, building new ORs, new medical inpatient units, and really just advancing the facilities of our hospital to make sure that we're here for the next 50 years for the patients of Union County and the Southern 7 area.
Well, thank you so much for talking with me today. Is there anything else?
No, just appreciate the work you all are doing and glad to be a partner. Everybody come out for the walk. I want to see you there.
Very good. Well, once again, folks, thanks again. We've been talking with Harry Brokus he is the Chief Administrative Officer at Union County Hospital. Are you going to be out at the walk with us that day? Are you going to be able to make it?
I will be out at the walk September 23rd. It's on my schedule.
Awesome. Okay. Well, you're going to have to come out and meet him, guys. I'm telling you, he's a very nice man. And I've not known him very long, but you've always been gracious to me, and I appreciate that.
Everybody have a great day.
Well, that wraps up another episode of the Southern 7 podcast. I hope you enjoyed it as much as I did. I always enjoy talking with our interagency partners, and Union County Hospital is one of those. And I want to say thank you again to Harry Brokus for joining us today. Once again, if you'd like more information about the Cancer Warriors Walk for Hope, it's going to be coming up on September 23rd from 10 to 1 at the Dorothy Miller Park in Metropolis. I invite you to come out, Bring your friends, bring your family, bring the kids, bring the family dog. Again, this is going to be a fun time for everybody to come out. This is a free event. This is not a fundraiser. It's just an opportunity to have some fun with your family and your friends. We're going to have a lot of activities out there for the kids to do. We're going to have bounce houses. We're going to have the strolling through the colon, our big 20-foot inflatable colon for you to come in and stroll through. We're also going to have our WOW van out there that day doing genetic cancer testing and at-home colon cancer kits for you. A lot of activities. And again, we're going to have food vendors. I want to mention that. We will have food for you to purchase. So just come out and have a good time with us. Just to spend the day with us. Again, it's from 10 to 1 at Dorothy Miller Park on September 23rd in Metropolis. You don't want to miss it. I want to send a very special thank you to our healthcare partners in this effort for putting this together and just all that you've done to make this event happen. I want to say thank you again to Union County Hospital, Massac Memorial Hospital, Rural Health Incorporated, Community Health and Emergency Services, also known as Chessie, the Hope Light Foundation, and Banterra Bank of Metropolis. Thank you so much for all your help in this. Well, once again, we thank you for listening to today's episode. If you'd like to hear other podcasts from Southern 7 Health Department, just download the Southern 7 app or visit us online at southern7.org. From all of us here at Southern 7 Health Department and Head Start, have a wonderful day.